2021, WHO designated a variant of concern, named Omicron. Researchers around the world are conducting studies to better understand many aspects of Omicron. While we wait for more findings to be updated, let us take a look at what we already know of the new Omicron variant as of November 29, 2021. The new COVID-19 variant was emerged in Southern Africa. It has left countries around the world scrambling to respond. The Omicron coronavirus strain was first noticed by a South African doctor when COVID-19 patients found their symptoms didn't fit the classic Delta variant profile. So far, patients have not reported loss of smell or taste, and there has been no major drop in oxygen levels unlike the Delta variant. It is still not clear if Omicron is more transmissible than other variants or causes more severe disease. The naming of the coronavirus variant adopts the Greek letters naming system. There are now 7 variants of interest or variants of concern, and they each have a Greek letter. The naming system, announced by the World Health Organization, makes public communication about variants easier and less confusing. For example, the variant that emerged in India is not popularly known as B.1.617.2, but rather it is known as Delta, the 4th letter of the Greek alphabet. It is also unfair to the people where the virus emerged when people describe the variant that emerged by the place they were detected, which is both stigmatizing and discriminatory. It is also misleading. For example, we called Spanish flu, but the flu did not come from Spain. The emerging country was unknown, but there's a possibility it emerged from the US. Naming the variant avoid causing offense to any cultural, social, national, regional, professional, or ethnic groups. The WHO's decision to classify Omicron as a variant of concern is based on several concerning mutations the variant has that may change the way it behaves. 1. Preliminary evidence suggests people who previously had COVID-19 could become reinfected more easily with Omicron variant. Secondly, it has also been detected that the new variant has faster rate of infection. The WHO said that preliminary data do suggest that there are increasing overall numbers of people becoming infected. The WHO also says that Omicron has more than 30 mutations on its spike protein, more than double the number carried by Delta. The spike protein is what the virus uses to attach to human cells. Thirdly, the places that the variant has mutated are places that we know from previous variant are dangerous spots. It will require several weeks of observation to understand the level of severity. There are currently relatively few confined Omicron cases to suggest anything. The WHO states that there is currently no information to suggest that symptoms associated with Omicron are different from those other variants. The South African doctor who first spotted the new variant said that Omicron tends to produce milder symptoms. The most severe case that she has seen so far was in a 7-year-old child who had a high fever and faster heart rate. Many early infections have been in younger people. And it is still unknown if the new variant acts in more vulnerable populations, such as older people. There have been no reported deaths due to Omicron variant yet. More studies are underway to understand the impact of Omicron variant on vaccines. Vaccines remain critical to reducing severe disease and death. The widely used PCR tests continue to detect infection, including infection with Omicron. WHO recommended the most effective steps individuals can take to reduce the spread of COVID-19 virus remains. That is, keeping a physical distance of at least 1 meter from others, wear a well-fitting mask, open windows for improved ventilation to avoid crowded spaces, keep hands clean, and get vaccinated. The road to recovery will be slowed with the emergence of Omicron. Before the emergence of Omicron variant, we are seeing the world slowly on the road to recovery, and countries opening up their borders welcoming tourists. Israel, which has fully reopened to vaccinated tourists just 4 weeks ago, is expected to again be closed to foreigners due to the emergence of Omicron variant. Similarly, Morocco said that it would deny entry to all travelers, even Moroccan citizens, for 2 weeks. While some countries close its borders totally, places like United States, Britain, Canada, and the European Union only announced bans on travelers from Southern Africa.
That's all for now. See you next time. Remember to help us like and subscribe. Thank you.